Back now on Most Buffalo, February is National Cancer Prevention Month. Kaleida Health is launching a new program aimed at catching lung cancer early and when it is most treatable. The initiative offers low-dose CT scans to people who meet certain risk factors, including age and smoking history. Here to tell us more is Dr. Azam Ghafoor, a medical oncologist specializing in lung cancer treatment. Thanks for coming on, Dr. Ghafoor.
Thank you so much.
So this new program is going on now.
That's correct.
Who are you trying to reach with this new screening program?
So essentially we're trying to reach high-risk individuals to getting lung cancer. That's typically your heavy smokers, age 50 to 80 years old, and who've smoked about 20 pack history smoking. So what that means is that if someone smoked 1 pack per day for 20 years, or someone who smoked 2 packs per day for 10 years, that's equivalent to a 20-year pack smoking history.
And for an individual with that history, what is the typical path to diagnosis?
So the typical path to diagnosis is once we undergo the low-dose CT scan, then we risk and we classify how high risk the nodule lesion is. If it looks suspicious for malignancy, then we have a specialized team at Kaleida with pulmonologists, surgical oncologists, and medical oncologists like myself, who then create a specialized plan for that individual. If it's high risk, then we may proceed to a biopsy. But if it's a low risk, we may just follow up with a short interval scan.
And this new screening program, why was it needed? Why is it a good option for individuals?
Well, we know lung cancer is the most devastating and highest risk of mortality of all the cancers in the United States. And what we know from the studies that the low-dose CT can actually reduce lung cancer mortality or deaths by 20%. So this lung screening program is very critical, as critical, not less than your mammograms or your colonoscopies. So we're really urging these high-risk individuals, age 50 to 80 years old, and also they must have smoked within the last 15 years or current smokers. Because we know the risk, if someone has stopped smoking, beyond 15 years, that risk goes down.
So if this is sounding like someone that you know or yourself and you're interested in getting screened, what can people do?
So people can either self-refer. There's a phone number we have, 716-254-LUNG, or they can talk to their primary care doctor. And we have locations all around Western New York with Kaleida Health that can funnel those patients to us, and then we have the lung screening program here in downtown.
So you have it right at the hospital downtown?
That's correct.
And then what is the process like for that screening?
So the process is pretty simple. So they undergo a low-dose CT scan in the radiology suite. It takes a few minutes. It's non-invasive, it's painless, and usually the results are there within 1 or 2 days. And that's when we look at it together and see what is the risk of cancer if we find something.
And how important is it to catch any kind of cancer early during this Cancer Prevention Month? It
is absolutely important. So if we catch cancer stage 1, your 5-year risk of survival is greater than 75 to 80%. But if it's stage 4, advanced, that probability goes less than 10% of survival.
Anything else you would say to anyone who might be on the fence about getting screened?
So I think it's very important to stop smoking, obviously, and if you are a heavy smoker who meets that eligibility, then should definitely enroll in the lung cancer screening program. And I want to go further that in our program, we're actually expanding it to blood-based tests too. We know that lung screening CT may not only help, but there's also adding some genetic testing. We know genetic testing may actually accelerate the development of lung cancer.
And one more time, the phone number for people interested in the lung cancer screening program, the new program.
It's 716-254-LUNG.
Dr. Azam Ghafoor is joining us today from Kaleida Health. We appreciate it so much.
Thank you so much.